The Ministry of Health is actually advising against kissing, cuddling. So you and your mpoa, that's it.
Chorea.
Mpo wangu wana MPOX.
I mean a kiss tu, inipate.
Tulifunga hii maneno juu sasa, so unajua ni till marriage. Pete, unatoana soko, huku ushika avocado, no way.
Jaba.
Do you know there's a vaccine for MPOX?
MPOX vaccine.
I am not aware, but yeah, I will just go ChatGPT is all the way, the boss.
Latest developments on the outbreak of the MPOX virus poses the question of individual preparedness. Here at Health and You, we help give you all the information you may need to know about the MPOX virus. Welcome to Health and You. My name is Maria Jones.
It's contagious. Unasikia umfai kugoteana.
Nimesikia ni vichembe unashikwa na kitu kama hiyo.
MPOX is a virus, just like we know COVID was a virus. So MPOX is a type of virus called orthopox viruses, and the key word here is pox, because we also used to have a virus called smallpox sometimes some years back, which was eventually eradicated, and it was a global concern at that time. So MPOX is similar to smallpox. However, it has milder symptoms compared to that of smallpox that used to be there. Smallpox killed a lot of people. If someone has been vaccinated before against smallpox, they will have cross protection against MPOX. And the reason is because they're just like brothers and sisters. They are in the same family of viruses. And the protection would be up to about 85%.
Nimesikia inatoka sijui ina originate from animals sijui pass to human beings.
Inatransferiwa na like saliva na watu wenye wana come in contact usiku.
One, it can spread from animal to a human, and that's how the first spread may have occurred. Especially if someone is handling the animals, or they are cooking the animal meat, bush meat, especially from rodents or monkeys, or there are communities that eat those types of meat. The other method of transmission is human-to-human transmission, and human-to-human transmission has different aspects of it. One is very close contact, like hugging, cuddling, kissing, and even sexual contact. And it's also known to spread more easily in men who have sex with men. And that's how, like in the US, it was easily noticed in that subcategory sometimes back. And the other way it spreads is articles or surfaces or belongings of someone who is a declared case, or somebody who has the symptoms because of the lesions on the skin, and either the beddings or surfaces, or even a phone that somebody has used who has had MPOX can potentially be the cause of the transmission. But there's also one last important one. So besides the sexual transmission, there's also the mother-to-child transmission as well that is possible with MPOX. Based on the fact that MPOX can be transmitted sexually, then it is also an STD.
Nasikia kuna venye unajikuna huko downstairs, maybe kwa makwapa, unapoteza nywele, maybe kufura mapua, sijui cheeks.
The symptoms of MPOX are a wide range of symptoms. We have flu-like symptoms like headache, feeling sick, feeling just tired, and those are the general symptoms. But you also have more specific symptoms like the MPOX rash. And the MPOX rash is very specific. It's closer to the smallpox rash that initially start as small pimples or small areas that initially they are not raised, and they are a little reddish. The rashes can happen on the face, on the arms, and in other different parts of the body. And that's like the classical symptom of MPOX. However, we have patients who don't exhibit those classical symptoms, and especially those who have mild disease who will just have fevers and headaches. Yeah. But there is one symptom that is very specific to MPOX that has not been more for other conditions that are similar. You know, there are conditions like chickenpox, for instance. It also has a pox, and measles. Chickenpox and measles also cause rashes. But the defining factor or the defining sign between chickenpox, measles, and MPOX is swelling of the lymph nodes. And the lymph nodes can swell on the underarms, on the neck, or on the groin. And this is what is called medically with the term lymphadenopathy. It can get to respiratory infections like pneumonia, and a person can start coughing as well. It can also go to the brain and cause what we call encephalitis or brain infection, and those can even lead to death. That's how serious it can get. So we have different variants of MPOX, including, and they are just clade 1 and clade 2. In 2022, we had a different variant causing an epidemic, which was clade 2. And now we have another one called clade 1B, which is more serious in terms of the capacity to cause infections and to spread. And it can also be spread using other methods as well.
Reduce contact.
Mask, and the other thing also have the nini. Sijui kuoga ka itawaki juu ilikuwa life hack ya corona.
To protect yourself from transmission, you have to know what are the methods of transmission. And one of the common methods is close personal contact. So avoid close personal contact. That means shaking of hands, kissing, especially in suspected cases, cuddling. It also can be spread through the sexual route. So you have to avoid that, especially a suspected case. And then the general hygiene, like the one we used to use during the time of COVID. Washing of hands, ensuring you're clean all the time. You know, general hygiene is also very important as part of preventing MPOX.
Nimesikia it's a disease that ina subside after a few times. So unaweza incubate yourself. Ujitingie tu kejani bora uko na mtu kukuletea chakula na uko na TV.
If you suspect you have had contact with someone who has MPOX, number one rule is do not go visiting all your friends and neighbors and relatives because you might infect them. Go to your house or your home, isolate yourself, and call the hospital or call a doctor from your contact list. Let them know that you've had a contact that was suspected to have MPOX, so that let the medical people handle it, because it requires isolation. Yeah, and once, if you feel you have a fever or you have any symptoms, then obviously that's a medical issue. The doctors or whoever is going to attend to you will give you medications for it. And most of the medications or the treatment is supportive. MPOX is mostly affecting children more than adults. In fact, the very first case of MPOX, according to the historical data that we have, was detected in a child who was 9 years old. So vaccines are available, and interestingly, the same vaccine stockpile that was there for smallpox is the same type of vaccine that we are using, that doctors are using at the moment in vulnerable countries like the Democratic Republic of Congo. Last I checked, had already received some vaccines. And there are different brands of vaccines, but there is one particular one called Jynneos. JYNNEOS.
The ministry has not been clear. On corona, they were so strict. So MPOX, I don't believe it is really, I don't even think it is in Kenya, but I've heard there are some cases, but the government is not serious on it. They should create good ways to create the awareness so that at least we know what we can do in case we just be aware, like the ones that they created for corona.